India has crossed the 1,000 mark in active COVID-19 cases, with Kerala leading the tally at 430. Delhi reporting 100 cases, including 99 new cases this past week, viewers. While the rise has drawn attention, health officials are urging calm. And Delhi's Chief Minister Rekha Gupta says there is no cause for alarm. Hospitals, she said, are fully equipped and advisories are in place to manage any increase in cases. Meanwhile, in fact, information that's coming in is that India's virus tracking network has identified new subvariants, NB181 in Tamil Nadu, LF7 in Gujarat. Both are under monitoring, but not variants of concern. In fact, JN1 remains the dominant one in India. Hospitals in the national capital have been advised to stay alert, ensuring equipment is functional. So since then, since COVID pandemic 5 years back, India is a lot wiser. Staff is trained, equipment is functional, protocols are in place, masks are now being made mandatory. So to that effect, India has ensured that all its guardrails are up. What can we do next? Let's quickly now get in Dr. Sanjeev Bagai to understand what is it that we should now be focused on. Dr. Bagai, what should be our alarm bells and warning signs that we should be watching out for?
Good evening. So I think it's a matter of taking precaution, but there is no immediate cause of panic or anxiety or any fear. We have seen in the last month or so a sudden rise, and especially in the last week or so. What we are seeing in Indian diaspora mainly is the Omicron subvariants, which is called as JN.1, and then they have had convergent and recombinant mutations to have LP 8.1, LF 7.2, and so on. These are all original breakaways of JN.1, which is of the original strain of what we call as BA 2.86. These are not as lethal, although they may be slightly more transmissible. The third point here is that the immune escape mechanism is very heavy here. So these are one of the fittest mutations, what we call as. These are called as flip mutations, especially in the area of the amino acid LS455. The clinical impact is that if you
Sir, please decode, Dr. Bagai. Let's keep it simple.
Yeah.
A lot of people are just scared and they are anxious, but they can't understand this language that you're talking, the lingo that you're explaining it in.
Yeah, clinically speaking, there is no need for immediate revaccination or any booster dose. There is no need of any antivirals to be given. There is no need of any antibiotics because it's a viral infection. Most of these are very, very mild, subclinical, and the rate of admission and indeed oxygen requirement is very low. Therefore, there is no need to panic. Since it is transmissible, it's an airborne infection. Wearing a mask, especially in crowded areas, close clusters, or poorly ventilated areas, is of paramount importance. If you have fever, isolate yourself at home. Don't expose yourself to others. If you are in a crowded area, wear a mask. It will prevent infection for yourself or for you to transmit it further.
All right, we leave it there. Dr. Bagai, thank you so much for explaining to us. Essentially, it boils down to, viewers, exactly what you and I have learnt in the last 5 years, which is isolate yourself if you have symptoms, do not get alarmed, and more importantly, keep watching for any alarm signs.